All right. Well, thank you for joining us today. I'm Natalie Nordland. I'm a consultant with the New York State Trauma-Informed Network and Resource Center, or TINRC. Welcome to our webinar, where we'll be providing an overview of the Trauma Responsive Understanding Self-Assessment Tool, or the TRUST 2.0 for organizations. And during this webinar, I'll be providing an overview of why the trust was developed and how it can be helpful for your organization to guide reflection and working towards engaging in trauma-informed practices. And also we'll show you the website where you can register and access the tool. My colleague, Sydney Brown, is with me today as well, and she'll be monitoring the chat. Feel free to ask any questions that you may have in the chat. Although, while we're recording this webinar and making it available for you and others, we're going to wait till the end of the informational presentation to answer any questions you may have. And you're also going to be welcome to ask those questions in the chat or unmute yourself and ask them out loud. So once we begin our Q&A, we'll stop the recording and ensure that you feel comfortable unmuting yourself and asking your questions if you would like to do so. All right, so to first provide an overview of the New York State Trauma-Informed Network and Resource Center, or TINRC. This initiative, which was founded in 2018 and funded by the New York State Office of Mental Health, aims to elevate conversations and understanding of trauma, toxic stress, and well-being to support individual, organizational, and community action. And at the New York State Trauma-Informed Network and Resource Center, we envision a New York State where all people and their communities can attain wellness and resiliency, and that all systems have the tools to support healing from toxic stress and trauma. And grounded in that vision, the TINRC's mission is to promote learning, growing, and the deepening of knowledge. And to work towards this, the TINRC creates partnerships, builds communities, and furthers the understanding of trauma, trauma-responsive practices, wellness, and well-being. TINRC's work is grounded in the guiding principles and values of trauma-informed practices, those being safety, trust, responsiveness, empowerment, peer support, and collaboration. And moving from learning into action and application can be challenging. And so we want the TINRC to support individuals and organizations in their understanding and application of trauma-informed and equity-focused practices. And so the Spectrum of Prevention Framework, it's a systematic tool that promotes a range of activities for effective prevention. And it's been used nationally in prevention initiatives for traffic safety, violence prevention, injury prevention, nutrition, and fitness. The spectrum identifies levels of intervention that helps people move beyond the perception that prevention is merely education. At each level, the most important activities related to prevention objectives are identified. And as these activities are identified, they lead to interrelated actions at other levels of the spectrum. And all levels are complementary and synergistic. And when used together, they can have a greater effect than would be possible from one single activity or initiative. So in adapting the main components of the prevention framework for our TINRC work to help support understanding and application of trauma-responsive and equity-focused practices, we feel it's important that organizations and individuals hold that collective work of the TINRC. Events, programming, offerings, that collective work is intentional, and it's intending to build more trauma-responsive and equity-focused organizations and communities through resources and supports across multiple components. So the TINRC events, programmings, and offerings that we have are aligned with the main components of the prevention framework, which are elevating stories and work being done across the sectors and regions, supporting organizations and practice change, which aligns with the Trust 2.0 that we'll be talking about today, curating and maintaining networks and connections, educating community and providers, and strengthening knowledge and skills. And in knowing that the journey to advance trauma-informed and equity-centered practices within organizations and communities takes steadfast commitment to one or all of the main components of the prevention framework, the New York State TINRC provides resources and supports to facilitate and fortify the trauma-informed journey. And we invite individuals or organizations to begin or further their journey with the resources and supports outlined in the New York State TINRC Pathways of Engagement. So this slide outlines the pathways of engagement that organizations and individuals can take within the New York State TINRC to support their journey and becoming more trauma responsive and equity focused. And in looking at ways organizations can support their journey, you'll see that one of those ways is for organizations to utilize the Trust or Trust 2.0, and for schools or districts to utilize the Trust S and to receive consultation of their results. But before we start talking about these tools, and more specifically the Trust 2.0 for this webinar, let's first talk about why reflecting on and working towards creating trauma responsive systems and workplaces and workplace environments is important. So what do we mean by when we say trauma informed and trauma responsive? Why should workplaces care about this? Well, let's start with the definition of trauma informed. So to put simply, to be trauma informed means to understand the role that victimization and violence play in the lives of most people, and to use that understanding to design workplace environments that accommodate the vulnerabilities of trauma survivors. So you'll notice here an emphasis on most, to understand the role that violence and victimization play in the lives of most people. But why am I calling this out? And why does this matter for the Trust 2.0 tool that we'll be talking about today? Because unfortunately, most of us have endured trauma. Trauma is when we experience very stressful, frightening, or distressing events that are difficult to cope with or out of our control. It can be one incident or an ongoing event that happens over any period of time. And when we say most, we mean it, the majority. Just in the United States alone, 70% of adults have experienced some type of traumatic event at least once in their lives. So that translates to 223.4 million people having experienced some kind of traumatic event. And within the public health system, over 90% of clients in the United States have experienced trauma. So if we translate these stats into scenarios that we may come across at work, taking that 70%, if you're in a meeting with 5 people, 3 or 4 of those people most likely have experienced trauma. And in thinking about any trainings, team events, or staff meetings that you may attend, if there are 50 people present, 35 have most likely experienced trauma. It's an unfortunate reality that trauma is omnipresent. Some studies go so far to say that we should assume that we've all been impacted by trauma. And I think that's unfortunately a fair estimate, particularly noting the recent COVID-19 pandemic that we've all endured. And in addition to most, if not all, people having experienced trauma, we must consider the additional impact of work-related stress and how stress can further impact people who may or may not have experienced trauma. Workplaces are perfectly designed environments to have stress. There are constant demands and often only a finite amount of time or resources to do them. And it is the perception of stress that hinders our ability, particularly when we've endured trauma, that we may feel a sense of overwhelm, a sense of lack of control to effectively respond, and therefore may feel hindered in our ability to progress and move through or cope and overcome what is deemed stressful to us. 83% of US workers suffer from work-related stress, with 25% saying that their job is the #1 stressor in their lives. About 1 million Americans miss work each day because of stress. 76% of US workers report that workplace stress affects their personal relationships. Depression-induced absenteeism costs US businesses $51 billion a year, as well as additional $26 billion in treatment costs. More than 50% of workers are not engaged at work as a result of stress, leading to a lack of productivity. So we see the significance here in that stress and the management of it is important in the systems that create it, such as workplaces. So with the understanding that most, if not all people, have experienced trauma, and awareness that workplace environments can further cause stress, the Trust 2.0 and Trust S are tools that can be helpful on an organization or school's journey in moving away from the dominance of individualism and toward promoting a system and workplace environment that is trauma-informed and trauma-responsive. Tools that can help an organization or school or district work on a systems level towards unlocking the potential for genuine empowerment, resiliency, safety, and belonging, in turn leading to sustainable engagement and enriched employee well-being. So the Trust 2.0 is a strengths-based self-assessment tool that provides organizations a point-in-time snapshot of where they are in their journey towards becoming trauma-informed. The survey is completed individually and anonymously online by all staff and leadership who choose to take the survey, and it takes only about 15 minutes to complete. After an organization has decided to close the survey round, they're then able to generate and download an automated report that includes a summary of key findings across all who took the survey, and these findings are scored and organized across the 10 domains of trauma-informed organizations, which will be shown on an upcoming slide. The Trust 2.0 is encouraged to be re-administered over time for progress monitoring, such as on an annual basis, to help guide continuous reflection, evaluation of progress, and continued growth. The Trust was originally developed by CCSI in partnership with the Institute of Trauma and Trauma-Informed Care at the University at Buffalo for New York. It was funded by New York State Success, a SAMHSA grant to increase accessibility to all organizations across New York State to be able to assess and receive guidance on moving their practice change forward. And it was intentionally designed to be cross-sector, with the understanding that the entire system needs to embrace trauma-informed practices. And in recognizing the need for a revised version of the tool that's more consistent with school terminology and culture, CCSI also developed the Trust S for educational institutions. A recently revised version of the Trust 2.0, is now available on the new Trust website. And similar to the original version of the Trust 2.0 continues to employ SAMHSA's 10 implementation domains of trauma-informed organizations, which I'll be showing on the next slide. And the Trust 2.0 was updated and revised to incorporate an equity lens throughout all 10 domains and was revised to meet the needs of both direct service and non-direct service providers and organizations. So as previously mentioned, the Trust 2.0 continues to employ SAMHSA's 10 implementation domains of trauma-informed organizations, those being governance and leadership, policy, physical environment, engagement and involvement, cross-sector collaboration, screening, assessment, and treatment, training and workforce development, progress monitoring and quality assurance, financing, and evaluation. The questions within the survey are aligned with and organized by these 10 domains, and the survey report that's produced provides aggregated results across these 10 domains, along with domain-specific actionable recommendations and links to resources. And within your automatically generated report, you're also able to see a summary of findings across the 10 domains. So here's a screenshot of part of the domain summary page of an example Trust 2.0 report. Overall results are given to help paint a picture of where your organization is at on your journey, and includes areas of strength, emerging strengths, and growth areas, and how this may differ in perception between staff and leadership. And you're additionally able to see the percent of don't know responses within each domain across the survey respondents, which can help to further reflect on why this might be. So for example, you might find that the policy domain is an area of strength, but there's a high percent of don't know responses. So then it would be helpful to reflect on why this might be, such as limited communication and shared understanding of policies across staff and leadership. And beyond seeing an overview of the results by each of the 10 domains, you're additionally able to take a deeper dive within each domain to look at the summary of responses for each question within each domain, which might further highlight specific strengths and areas for improvement to help guide action planning. And recommendations that your organization can use to strengthen your trauma-sensitive practices, as well as links to resources for each domain, are additionally provided to help guide reflection and action planning. And through the New York State TINRC, the Trust 2.0 is available at no cost to all New York State organizations. And in addition to the direct link to the Trust site that we'll be providing you in the chat, the link to the Trust website can also be found on the TINRC website under the Initiatives tab, which we'll be putting in the chat. And you're now able to register your organization on the new Trust website that's just launched this week, and utilize the newly launched Trust 2.0. And additionally, New York State organizations are also able to request a free 1-hour virtual consultation session with a TINRC consultant after taking the Trust 2.0 to help further understand results from your Trust report and utilizing findings to take next steps. This consultation session can be requested once logged in to your Trust account. And since the initial launch of the Trust and the Trust S, over 350 New York State organizations and educational institutions have utilized these tools, many deploying the survey multiple times for progress monitoring. The Trust and Trust S have been utilized across various organization or educational institution sizes, locales, sectors. They've been utilized by healthcare provider networks, state agencies, county systems of care, community-based organizations, county health departments, schools, school districts, behavioral health organizations, and more. And to provide an example of how one organization in New York State has utilized the Trust over the years, along with the Trust 2.0, which they were part of piloting, YWCA of Rochester and Monroe County, it's a nonprofit organization that provides direct services, empowerment programming, and advocacy to support marginalized individuals, especially women and families experiencing housing insecurity, while working to challenge structural barriers to equity. YWCA is an organization that has been steadily working at transforming practices and culture to ensure everything they do is in the framework of trauma responsiveness and equity. And they've utilized the Trust over the years to continually evaluate and reflect on areas of growth and opportunity, and utilizing results to help guide their strategic planning. As indicated here by YWCA's VP of Strategic Partnerships, culture transformation is hard to measure outside of typical metrics like program outcomes, staff retention, and satisfaction. We were thrilled when CCSI developed the Trust Survey because it was a resource that we could use free of charge and benefit from consulting services and community partners to help us drive strategy for the future. So as Carrie highlighted, the Trust can help measure a snapshot of where an organization is on their journey and continued transformation. And beyond typical metrics such as those mentioned, it can further allow to hear all staff voices and perspectives anonymously, and specifically evaluate staff and leadership perspectives related to trauma-informed practices within and across an organization. Now, without further ado, let's explore the website. And the website can be found at trust-survey.com, which we'll also be putting in the chat for you. And I will click on this link and I will stop sharing and reshare so you can see the website. All right, so once you arrive to the site, you'll first be asked to select the location of your organization or educational institution. So once you select, you'll be taken to the site. So we will select New York and click go. So once you've entered, you're going to be able to learn more or refer back to information about the Trust 2.0. And you'll be able to access resources, including technical guidance and report interpretation guidance videos, an implementation support guide, information about requesting consultation, which you'll be able to do once logged in to your account, and also additional resources to support your work going forward through the TINRC, beyond the resources that would be provided in your report. And you'll also be able to access answers to frequently asked questions, and can also contact the Trust team with any questions or inquiries you may have. And you'll also be able to log in or register. And I do want to note that if you previously registered your organization prior to the new website launch date, that was yesterday, June 24th, you'll need to register or re-register on this new site. And if you have any past reports that you still want to continue to access and download to compare to any new reports that you might have and generate, you're still able to access them on this older version of the site. So once you've registered and you have your login, you're going to be able to log in and access your dashboard. And so as an organization administrator is what you'd be referred to if you create an account for your organization, you're going to be able to create one or more programs for your organization. So for example, maybe you just want one program created where all of your staff and leadership across your organization are part of the same survey round, and you want one report based on their collective results across the entire organization. Or maybe you want to have a separate survey you want to have separate survey round reports, such as different reports based on different locations, departments, or programs across your organization. So in that case, you could create multiple programs to ensure that those different groups receive different unique survey links to generate separate reports for each group. In addition, while you have one organization administrator, which may be you, you're able to assign a program administrator for one or more programs you've created. So for example, if one primary person is the organization administrator for an organization, you may decide to create separate programs for each location across an organization and assign a leader from each of those locations as a program administrator for each location. So even if it's separate locations, for example, within the trust website, it would be considered or called a program. So you're able to add any additional people here. And so once you've created one or more programs for your organization, you're then able to generate a unique survey link for each program to send out to staff and leadership. So I'll show an example. So if you want to edit and share, you'll see your unique survey round link. And there's also an example email template provided for you to utilize and modify as needed as well. And then after you have had your survey round open for the length of time you would like, you've collected responses from staff and leadership. And note here, you're also going to be able to see the number of responses that you've gathered so far for all the survey rounds that you've created. Then you're able to generate, view, and download your survey report. So I am going to show you an example. So once you click on View Survey Round Report, so this is an automatically generated report from sample survey responses, and you're going to be able to see them, the whole report directly within your browser, but you're also going to be able to download a PDF of that report. So I'll show you what it looks like. All right, so once you have generated your report, you're going to be able to see the demographics of the survey respondents, those who took the survey, which can be especially helpful in maybe comparing the demographics of survey respondents to the actual demographics of your organization in terms of, reflecting on whether the results are truly representative of your organization population. And then, like shown in the screenshot on the previous slide I showed, you're going to be able to see a summary of overall results page so that you can see across the 10 domains and across not just your entire organization, but also across staff and leadership, areas of strength, emerging strengths, areas of growth, as well as the % of don't know responses. And then you're going to be able to take a deeper dive within each of those domains and each of those questions within them to see if there's further any specific items or areas that you want to focus in on and reflect on, certain things that might be identified further as areas of strength or areas of growth. And then you're additionally provided with recommendations for each domain, as well as links to resources. And an additional thing to note is that at the end of your report, if survey respondents provided any There's one final question on the survey that is an open-ended written response question. If anybody decided to provide any additional thoughts, comments, questions, they're able to be presented here anonymously so that you can further reflect on those as well. So I'll stop sharing and reshare the slideshow. That does bring us to the end. I just want to say thank you so much for joining today to learn more about the Trust 2.0. And we hope that this informational session was helpful in learning more about how this tool can help your organization on your journey in becoming trauma informed. And we'll now be stopping the recording and answering any questions you may have in the chat or would like to ask out loud. And we also welcome you to reach out afterwards via the contact form on the Trust website or by emailing my colleague Denise Quamina with any questions you may have. And here is her email address, and that will also be put in the chat. In one moment, I will stop recording.